We're still a far way off because depending on what variant we are dealing with, the percentage of the population that needs to be immunized would go up. Right now, some of the experts believe that with the Delta strain, you have to get closer to 90% of your population being fully immunized.
Minister Anthony during his daily COVID-19 update. At present, 365,208 adults, or 71% of that population, have received the first dose of a COVID-19 vaccine, while 215,553 adults, or 42% of that population, have received both doses. This means an additional 48% of the country's adult population would need to be fully vaccinated in order for herd immunity to be achieved. This ambitious attainment, however, remains a challenge at this time, since a vast percentage of the country's population cannot access the vaccines.
There's no vaccine that has been approved for persons 11 years and lower. We are hopeful that in November that the US FDA would approve for vaccines in this low age category, at least from 5 to 11. And when that is done, we'll then be able to introduce vaccine for this age cohort. So there's still a substantive part of our population that cannot receive a vaccine because no vaccine has been approved for that age category as yet.
It is expected that the Pfizer vaccines will become approved for use on children between the ages of 5 and 11 in November. Once this approval is granted, the ministry will begin its vaccination campaign for this age group. Just a month ago, the vaccination campaign for adolescents aged 12 to 18 was officially rolled out and has so far seen 25,356 adolescents receiving the first dose, while 13,919 adolescents have received both doses. But even as the vaccination campaign for this age cohort has been a success, a post-mortem examination conducted on 13-year-old Joshua Henry revealed that he died from a massive brain bleed and heart disease. The lad, who hails from Maruka in the Northwest District, collapsed and died shortly after being administered a second dose of the Pfizer COVID-19 vaccine on Monday. On another note, the minister divulged that with the continued increase in hospitalizations, the ministry will soon place an oxygen plant at the Ocean View facility.
That would help to reduce the amount of oxygen that we have to purchase on a daily basis. So, as of today, we have 81 patients of the 136 that requires oxygen. And as you can imagine, consumption of oxygen is taking a lot of resources.
Meanwhile, as Guyana joins the rest of the world in observance of Breast Cancer Awareness Month 2021, the minister made a call to cancer patients to get vaccinated.
With the adenovirus vaccines that we use, so the vector vaccines that we use, so that includes AstraZeneca, Sinopharm, Sputnik V. There's no contraindication, so you can get your vaccine and go and get your mammogram, and that would be fine.
Since the introduction of COVID-19 vaccines, various health organizations around the world have been advocating for cancer patients to get vaccinated against COVID-19. It is believed that living with any type of cancer puts persons at a higher risk of severe illness from COVID-19. For the HGP 90 News, Kendell Richmond.